So liver cancer is one of the most common cancers in Singapore. It's currently the third most common cancer in males. In the latest cancer registry in about 2008 to 2012, over 2,000 cases, new cases of liver cancers was detected in Singapore. So we rank as one of the highest incidents in the world because of our high incidence of hepatitis B as well as hepatitis C infections. Unfortunately, liver cancer do not have a lot of symptoms or signs until it's diagnosed late. But in specific group of patients who are high risk, for example, hepatitis B and C carriers, liver cancer can present with pain, jaundice, or even some in late stages yellowing of the skin. So for liver cancer, the survival would depends on how advanced the disease is. In early liver cancer, if they are resectable or they can be transplanted, the survival rates is actually very good. In our institutions, we are able to match the international standards. 1 year survival for early stage, for example, stage 1 or early stage 2 can be more than 90%. And even up to 5 year survival, more than 50-60%, and this is as good as, if not better than, international rates. For example, in advanced cancers, in stage 3 or stage 4 cancers, unfortunately, once they become unresectable by surgery, then the survival rates drops drastically to about 20% in 1 year. In 5 years, less than 10%, unfortunately. Yeah. Liver cancer is usually diagnosed through a variety of methods. When they have signs and symptoms, or for example, the liver function test has abnormalities, first, physical examination and history is important to elicit if the patient has risk factors, for example, hepatitis B, C, whether the patient has a habit of drinking a lot of alcohol, or even if they have fatty liver or a history of cancers. Then the next stage will move to imaging. Several imaging modalities. You can start with simple ones like ultrasound, but eventually we'll do what we call contrast enhanced imaging, like a CT scan, MRI, and this will actually usually give us quite a good idea of whether the lesion in the liver is a cancer or not. If the imaging and the history doesn't give us a better idea, and then we move on to, for example, invasive methods of diagnosing, like for example, getting a biopsy. But 80% to 90% of the time, based on imaging and blood tests and history, we are able to get the diagnosis correct. So liver cancer can be treated with a variety of methods. Surgery is the mainstay of treatment because it provides the best chance for survival. That's why surgeons are always at the forefront of liver cancer. But having said that, liver cancer can also be treated or managed with other treatment options. For example, not just surgery, chemotherapy, or even what we call interventional methods, for example, ablation, and a combination of these treatments. For surgery-wise, liver resection or resection of the tumor is preferable if the patient is fit and the tumor is suitable. If the patient is a fit candidate and lies within the transplant guidelines, liver transplantation is also a treatment option for liver cancers. And having said that, if the liver is advanced and surgery is not a suitable option, for example, if the patient is very old, not fit, or lies beyond the liver transplantation criteria, then we can still treat the cancer with either chemotherapy or even directed chemotherapy to the liver. For example, what we call transarterial chemoembolization, when a catheter is put up to the artery supplying the liver and chemotherapy is directly given to the liver, and during the same time they will embolize the artery supplying the tumor, hoping to control the tumor. Next, then we'll go to chemotherapy. Chemotherapy can be generic chemotherapy, when they are so-called cytotoxic, but more and more we tend to give the patients what we call targeted therapy if they're suitable, where these targeted therapy are the newest line of treatment that has been shown to have better effects on these liver cancers. Hepatitis is a disease when we know certain type of virus attacks the liver on a daily basis. So because of the inflammation and infection of the liver, there's a chronic process where the liver is injured as it continuously tries to heal itself. As a result, this liver is sick and is predisposed to cancer, because essentially cancer is a disorganized, uncontrolled growth of cells. When one of these repair processes is impaired, over time, the liver tend to grow tumors. And these tumors is why patients with hepatitis B and in fact C have a very high risk of cancers. In fact, if the patient has both hepatitis B and C, the risk is actually extrapolated. Liver cancer screening methods include imaging, for example, ultrasound, and we also do blood tests. Most of the time, blood tests include a liver function test as well as a tumor marker, what we call alpha-fetoprotein or AFP. To minimize the risk of liver cancers, if you have hepatitis B and C, you can make sure that your hepatitis B and C is treated, because the worse the infection is, the more your liver will be diseased or sick. So the higher chance of death. So make sure if you have hepatitis B and C, you can have flares, make sure you get it well treated. If alcohol has been shown to cause liver cirrhosis as well, so heavy drinking is a major factor, especially in the Western countries, for liver cancer. Fatty liver is one of the risk factors, and fatty liver is associated with having an unhealthy diet, high cholesterol, diabetes, all this all are part of what we call metabolic syndrome. So living a healthy life generally would also be beneficial.